are very excited tonight to have with us Celia Whiteman and Drew Preston from the Department of Health and Human Services to go over the work requirements tonight. And thank you for joining us. And I will stop my share and hand it over to, stop my share. There it is. Now I can see you all again. Okay, and I will hand it over to Celia.
Hello, thank you, Jennifer and Chrissy, for inviting Drew and I to present today. I'll try to steal the screen share. Hopefully, I don't have any technical difficulties. All right, you should be able to see my slide deck now.
Yes.
Perfect. All right, so to start off, my name is Celia Whiteman. I'm a communications specialist with Nebraska Medicaid. Myself and my teammate Drew are here to present a little bit about Medicaid work requirements, which I'm sure you have many questions about, and maybe you've heard about, but need a little bit more information. So I'll hand it off to Drew to introduce himself before we get started.
Yeah, good evening, everyone. Just want to echo Celia. Appreciate Jennifer and Chrissy inviting us on tonight to share a little bit about the new program requirements for Nebraska Medicaid here. I'm a program specialist with our policy team in Medicaid. I've been with DHHS for about 8 years. Yeah, I'm just happy to be here to help share some information that's hopefully very useful for y'all. But Celia will walk through the slides. We can try to get to questions throughout. I'll keep an eye on the chat and hopefully we can get to those quickly. But if not, hopefully we can have some time afterwards and go through any other questions that you have too. So yeah, Celia, take it away.
Thanks, Drew. All right, starting off, just a brief introduction on what work requirements are. So HR 1, also known as the One Big Beautiful Bill Act, was passed into federal law on July 4th, 2025. This bill made many changes to the Medicaid program, and one of those changes was the introduction of work requirements. Work requirements are now a condition of eligibility for people on Medicaid expansion to receive Medicaid coverage. So this only applies to people who are in the Medicaid expansion program. And that's really important because certain groups of people will not have to meet these requirements. Currently, Nebraska has 70,000 expansion members enrolled in Nebraska Medicaid, with a total Medicaid enrollment of about 336,000. So you can see that it's not the entirety of people that are enrolled in Medicaid that will have to meet these requirements. So what is Medicaid expansion? Medicaid expansion members are adults who are between the ages of 19 and 64. They have a low income, so this is defined as people who earn up to 138% of the federal poverty level, or about $22,025 for one person in a year. And for a family of four, this would mean that the family of four has an income of about $45,540. Medicaid expansion members are also U.S. citizens or they meet Medicaid immigration rules. People who are not Medicaid expansion members are people who are on Medicare, people who are pregnant, or people who are eligible for Medicaid based on having a disability. Another important thing to point out is if a Medicaid expansion member lives in a household with other people who are on Medicaid, whether or not that person meets work requirements only impacts their own Medicaid coverage. So if I live in a house with my husband and I am on Medicaid expansion, but he's in a different Medicaid category, and I don't meet work requirements, that will only impact my own coverage, but it will not impact my husband's coverage.
Celia, we have a couple of quick questions just right off the bat from Dolores and TT. Dolores actually submitted a couple of questions. I think we'll get to one of them in a minute, so won't get ahead of you there. But as far as like how whether you're in this Medicaid category. I don't believe that iServe shows that right now. I think it just shows right now whether you're active or not. Um, but it really is the kind of the group of adults in this age range, 19 to 64, that prior to when this program began in 2020, you may not have qualified for Medicaid. This is kind of the new, the most recent expansion of Medicaid under the Affordable Care Act. Don't want to get too into like policy jargon with you all though, but it's kind of that group of adults, 19 to 64, who you're generally not disabled. You don't have Medicare like it's on there. It's kind of those group of adults who generally speaking, prior to the beginning of this decade, they weren't on Medicaid in the past. So I hope that kind of narrows it down. We'll have a lot more information to share though. So
Perfect. Thanks, Drew. So work requirements started on May 1, 2026, so last Friday. This means that Medicaid began enforcing work requirements on that date for new applicants. So individuals who are applying on or after May 1st and deemed eligible in that expansion group that we explained on the last slide, they will be subject to work requirements. It looks a little bit different for people who are already enrolled in Medicaid before May 1st, though. So for those existing members who were already on Medicaid before May 1st in the expansion category, DHHS will check to see if these members meet work requirements as part of their next Medicaid renewal. So not everyone has their renewal at the same time. Members with renewal dates in May or June of 2026 won't have to show that they meet these work requirements until their next renewal in 2027. So DHHS will start checking if members have met work requirements for people whose coverage period ends on or after July 31st, 2026. So the first existing members that might see an impact to their coverage would be on August 1st, 2026. And members can check when their next renewal date is by logging on to iServe and checking in their iServe portal. So if you are in the group that needs to meet work requirements, there are 3 ways to comply or to be exempt. Those 3 ways are by completing qualifying activities, having an exemption, also known as exclusions or exceptions, or having a temporary hardship. So we'll get a little bit deeper into each of those things here. So a qualifying activity is an activity that members or applicants under Medicaid expansion complete to meet work requirements. So these activities can include working, attending school or an apprenticeship, participating in a work program, or doing community service, also called volunteering. So members and applicants must spend at least 80 hours doing one of those activities that I mentioned. They can combine some of those hours in different activities to reach 80 hours during a qualifying month. For example, if someone is volunteering for 40 hours and then also participating in a work program for 40 hours to reach 80 total hours in a month. People can also meet work requirements by attending school or an apprenticeship at least half time. So half time is going to be half of whatever that school or apprenticeships total enrollment hours are. So that'll be based on what they consider a full-time student to be, and then half of those hours. But if someone is attending school and apprenticeship less than that half-time requirement, then they can take however many of the equivalent hours are and combine it with other activities like working to reach a total of 80 hours. Another way to have a qualifying activity is through income. So members and applicants can also work and earn the federal minimum income in a qualifying month. So Medicaid will use the household income, which this might be different than your own individual income if you have a spouse or someone else that lives in the house with you that you file taxes with. So the equivalent of 80 hours worked at the current federal minimum wage is the minimum income to meet work requirements. This is $580 a month, which is about the equivalent of working 80 hours at $7.25 an hour. If you're a seasonal worker and in the expansion category, you can combine the income from over the last 6 months for an average of $580 because sometimes people with seasonal jobs might have a lot more hours in one month and less in the next month. Another way to meet work requirements is to have an exemption. We also call these exclusions or exceptions. So some of the really important ones are going to be people who are parents, caretakers, or guardians of children up to age 13, or individuals, or they're caretakers of individuals with disabilities. Um, and then also people who are medically frail or have special medical needs. These can include blindness or disability, substance use disorder, disabling mental disorder, or other physical, intellectual, or developmental disabilities. You can see there are a few other ones on this list, like veterans with a total disability, women who are pregnant. So if any of the exemptions on this list apply to someone, then they will automatically meet work requirements. Another way to meet work requirements is through a temporary hardship. Some members and applicants might not need to complete those qualifying activities if they have one of these temporary hardships. So someone with a temporary hardship can be someone who was in the hospital or in a nursing home within the period since their last renewal, or for new applicants, we'll get into that time period as well. People who had to travel outside of their community to treat a serious health condition, and then also people who lived in a county that was under an emergency declaration or in a county with a high unemployment rate. So as I mentioned, the qualifying month, which is the month that a person meets work requirements, looks a little bit different for new applicants versus existing members. So for people who are applying to Medicaid, the qualifying month, and this just means the month that they have to show that they met work requirements. The qualifying month will be the calendar month before the month they apply for, and this is if they have a qualifying activity, so working, volunteering, work program, or income, and then for temporary hardships as well from the last slide. So if they have one of those to meet work requirements, then the qualifying month is the month before application. However, for exemptions, it's going to look a little bit different, and the qualifying month is going to be either the calendar month before they apply or the calendar month of the application. So for example, if an individual is applying on May 1 and they have an exemption, they can either have that exemption in May of 2026 or April of 2026. I'm going to show a visual to hopefully make it a little bit easier to understand. So if somebody has one of those qualifying activities, like working 80 hours, and they're applying in May, then they would need to show that they worked 80 hours in April. However, if they have an exemption and they're applying in May, they can either have that exemption in April or in May. One important thing to note is, actually, I'm getting ahead of myself. We'll get to the next slide and then I'll note that. The qualifying month for existing members is going to look a little bit different. So for existing members, a qualifying month is any one calendar month between their most recent renewal or determination and their next regularly scheduled Medicaid renewal. So for example, a member whose annual coverage period ends on July 31st, 2026 would need to have a qualifying activity exemption or a temporary hardship between August 1st, 2025 and July 31st, 2026. So in this example, an existing member would need to demonstrate that they met work requirements in any one calendar month out of the 12 months of their coverage period. Starting in 2027, it's going to look a little bit different because Medicaid expansion members will actually have semi-annual renewals instead of annual renewals. So instead of having renewals every 12 months, they'll have renewals every 6 months. So here's a visual to show for existing members that if you're applying, or excuse me, if your coverage ends on July 31st, 2026, you would need to show that you met work requirements in any 1 month since last August, 2025. So if, for example, you worked 80 hours in September, then you're all set for the rest of that renewal period. And then we also show that the renewal period will drop to 6 months for 2027. I'm going to pause for any questions for these last two slides because I know it's a little bit confusing.
And so I'll just jump in and say I've been doing my best to respond to folks' comments and questions in the chat function.
Oh, good.
So um, coming a little bit fast, trying to get to everyone here. But if we don't get to it, if I can't get to it, or if Celia doesn't answer your question, hopefully we'll have some time, or we're happy to connect with you afterwards too. So
Absolutely. Any like overarching confusions that we're seeing or?
no, everyone has a lot of really good questions. Kind of some common themes about what activities count, what counts towards exemptions,
Gotcha.
kind of the time frames as well, which you're speaking to right now. But why don't we go ahead and unless anyone has anything else they want to stop with here, we can maybe keep chugging along.
Perfect. Thanks, Drew. All right, Medicaid application and renewal updates. So Medicaid is updating the Medicaid application and renewal forms to include new optional screening questions. This allows members and applicants to provide information that will help verify whether that member met work requirements through qualifying activities, exemptions, and temporary hardships. These screening questions are optional and they won't delay the process of processing of an application or a renewal. But they just help us know a little bit more easily whether that member meets work requirements so that we don't have to continue to follow up with them. So Nebraska Medicaid will first review any information that we already have available to see if a member or applicant has already met work requirements through one of those activities, exemptions, or hardships. You might hear this process referred to as an ex parte review, but the most important thing to know is we look at the information we already have before asking you to provide any more information. So in many cases, DHHS expects that many members won't need to provide any additional information to show that they meet work requirements. So that way they don't have to fill out unnecessary paperwork or track down lots of information. But in some cases, we might need to ask for more information to make sure that people are meeting work requirements. So if we don't have enough information to make sure that that expansion member is meeting work requirements, then DHHS will reach out to the member or the applicant to ask for more information. They'll receive a verification of compliance notice, and along with that, they'll get an individual declaration form. So the individual declaration form, or IDF, can be sent to DHHS online through the iServe portal by mail, or you can talk to a DHHS representative over the phone. Members and applicants must respond to this request for information within 30 days after getting the notice, or they might be denied coverage if they're applying or lose their Medicaid coverage if they're already a member. So for members and applicants who don't meet work requirements, they might receive two different notice reasons. The first one will say failure to provide med work requirement compliance. This means that maybe the person didn't respond to that request for more information, so DHHS wasn't able to make sure that they met work requirements, or they might receive the notice that says failure to meet Medicaid work requirements, which might mean that the person did reply, but they maybe didn't list that they worked enough hours to meet work requirements, or another reason. Medicaid agencies are required to collect this IDF form for qualifying activities, exemptions, and temporary hardships. And I'll actually let Drew take it away from here, and then give a little bit more information on the IDF.
Yeah, absolutely. And that was, there's been a handful of questions throughout the chat that I'll mention that I haven't responded to yet because I thought this might be a good time to get to it. Good number of questions about the whole medically frail concept. What counts towards it? How do you provide DHHS information? Handful of questions in that respect. So hopefully this will answer some of those. If not, keep sending the questions over because I'm happy to work through those with you. But I'll share my screen here. Should work now with Celia turning hers off. Okay. All right. So Celia will get to this towards the end here. I'm showing the web page right now that we have a lot of information on, but um, at this point in our presentation here, I just wanted to take a couple of minutes to talk about this declaration form. This is kind of the main vehicle that at the moment that the department will be using to kind of gather information from folks on work requirement activities and exemptions. It's kind of one form. It captures activities, captures the different ways you could be exempt together. This is just a sample form. This would be what it would look like if you received one in the mail from DHHS. You can also do this on iServe too. It'll look different because the iServe webpage looks a little bit different. This is the print copy that would come in the mail for you. So we're on the topic of medically frail right now, so I'll just kind of laser focus on that. But if afterwards, after the presentation, we want to revisit this or there's more questions, happy to go through those. So you'll see there's a couple of different pages here. I think about 3 total of different questions about different activities and exemptions. For instance, about volunteering. About participating in work programs. So one of these questions, or really 2, I would focus on here.
Hey, Drew, can I interrupt quickly?
Yeah,
Would you be able
absolutely.
to zoom in at all?
Yes, sorry. My monitor might look a little bit weird on screen share, so I apologize.
It's hard to tell as the one sharing your screen.
Yeah, yeah. I can tell it's getting a little bit more zoomed in for you here. Yeah, thanks for calling out, Celia.
Of course.
So the 2 questions I would really want to highlight just at this point in our chat here. One is this question about, was this individual considered medically frail, or do they have special medical needs? Excuse me. So you would respond if this sounds like it applied to you. You would mark yes, and then kind of fill out these fields describing your health condition, a little bit of information of if you've seen a provider as part of receiving treatment for that condition, a little bit about that. If you've ever been on Medicaid while you're receiving care, that'll help us kind of verify that. If you've never been on Medicaid before, you're applying for the first time, we're not asking you to send in health records, doctor's notes, anything like that with this form. We're accepting this information from you at that point in time. And then in the future, you know, I have a chronic condition like a lot of folks do. It's going to be with me my entire life. So if that's not going away, Medicaid will be able to use the claims from your healthcare providers to kind of verify that, like, yep, this, you still have this condition. It still exempts you from from having to complete any of these activities as part of your coverage. So there's that question I wanted to highlight on here, and then above it, kind of at the top of my screen here is if you're a parent, guardian, or caretaker of someone who has a disability. So you can answer yes, and then just a little bit of information about that case, like I'm providing care for my child who has this condition, maybe my parent who has this condition. Um, just, and again, we're not asking you to provide any further documents, doctor's notes, anything like that about that. We'll accept this information from you this way, and that will kind of qualify you for an exemption from participating in these activities. There another I'll turn it back over to you, Celia, in just one second here. But one other kind of common thread I wanted to really briefly touch on was there's been some questions in our chat here about whether certain healthcare conditions qualify as medically frail. We do have a quite lengthy list on our work requirements webpage. I believe it's closer to the bottom, if I recall correctly. Yeah, medically frail right here. So there's a list of conditions that qualify. I didn't want to speak to them myself just because I don't have a clinical background. I didn't want to speak out of turn and provide maybe not quite spot on information, but there is that list there that you can take a look at, and then do reach out to our program if you have further questions after that, because we definitely want to get you the information that you need. So, yeah, Celia, with that, I think I'll turn it back over to you.
Thank you. So, we did have one question while you were presenting about, I'm confused about how I can, put down that I care for my disabled sister, who I cook, clean, organize, drive, assist. So for that, you would use that form that Drew just sent. Or if you were newly applying, you could also do the optional screening questions and just check that you are a caregiver for an individual with a disability. You can list a little bit about the condition, and then does it ask for the individual's name? I can't remember, Drew.
I don't believe it does. I'll double
Okay.
check, but yeah, because we're not that form would apply to you, not to the individual who you're providing that care for.
Right.
Timing wise, if the department doesn't already know, like for instance, for if you're a caregiver for like your child, someone who's in the same household as you, the department might already know that as part of your case record. We might not even send this form to you in those instances because we already know that. We're not going to ask you for information that we already have. But it's maybe some of those situations that we might not know of. Yeah, maybe like an adult sibling who you don't immediately live with, but you're like a full-time caregiver for. Maybe we don't necessarily have that information offhand, but it is a major part of your life and how you spend your time, and that's how you can let the department know about that. So.
Thanks. So for qualifying activities like volunteering, education, things like that, and then also exemptions and temporary hardships, you can submit a individual declaration form like we showed. So this would be education, participating in a work program, and volunteering, and then those exemptions and hardships. For work, Drew, can you explain? I think we accidentally got rid of a slide, but can you explain the difference with verifying work just briefly?
Yeah, absolutely. So as part of when you apply for Medicaid in general, this has been long-standing policy, but you do provide information about your income. So we don't have a special place for that on this form that I just showed you. Just because that's information that we already collect, as part of kind of standard business. So, I that's kind of the main reason that it's not accounted for on this form, and it's a little bit separate from some of these other pieces that we've been talking about so far.
Thanks. Sorry to put you on the spot. I'm like,
No,
it's not on the slide anymore.
no worries.
So once an applicant or member meets work requirements as part of the application or their renewal, they the work requirements won't be reviewed again until their next renewal. So we're not going to be checking every month to make sure, did you meet your work requirements this month? It's going to be checked at every renewal and just making sure that you met those work requirements in one calendar month since your last renewal. Some of the processes for verifying work requirements might change in the future based on federal guidance. So just make sure you're keeping up to date on any Medicaid changes, but everything we're presenting today is based on what the current guidelines are. All right, a little bit more about medically frail. I know we get lots of questions on that. So for existing members in Medicaid expansion, Nebraska Medicaid will review all the available medical claims data. So this is like if a doctor is submitting for payment for providing one of these services, if you visited the doctor, um, Nebraska Medicaid will review those claims approximately 90 days before a member's renewal. And if we find that any of those medical conditions or treatments are identified within those claims, then the member will be deemed exempt. We'll say that you met work requirements without needing to reach out to you for more information. Um, Applicants can self-declare that they're medically frail. So if you're newly applying for Medicaid, we're going to ask you to provide basic information about the medical condition, and you're not required to submit additional documentation. You're not required to put a doctor's note or health records, but you'll declare that you are medically frail. And then, like I said on the last slide, we'll check before the next renewal to see if you have any of those medical reasons in those medical claims. So if we don't find any of those medical claims at that point, then we'll send that form and request more information. So some of the key takeaways from this presentation: work requirements only affect Medicaid expansion members and applicants. So if if you're pregnant, if you are eligible for Medicaid based on a disability, um, and there's one more, if you're on Medicaid, then you're not in the expansion group and Medicaid work requirements don't apply to you. If you have a disability, but you are in the expansion group, or you're a caretaker of someone with a disability, then you'll be exempt. You'll meet work requirements by having an exemption. It's very important to make sure you're opening and responding to any mail that you get from DHHS. That's how we're going to reach out to you if we need more information to see if someone meets work requirements. If you're not sure when your next renewal date is, if you want to check on any information from DHHS, you can use the iServe portal and you can check that renewal date and you can see if anything else has been sent over. And then you can also review our website and other resources for more information. So I just want to stress again that work requirements affect those people who are in expansion. And if you are living in a household with someone who needs to meet work requirements, their work requirements will only affect their own Medicaid coverage. So with that, I'm going to just show you quickly the website. I think I'm only sharing my presenter screen, so I'll have to switch which screen I'm sharing.
And Celia, while you're switching over, could I tackle a couple of questions that we've gotten lately here?
Absolutely.
So Mindy asked a great question. If someone's applying for Medicaid, but they haven't sought treatment yet for a disabling condition, um, that's certainly if like a possible situation. A lot of reasons that people need Medicaid coverage is because they don't have another way to access other forms of healthcare coverage. So in those situations, we talked a little bit on that declaration form about how you have a disabling condition, or it is a question about medically frail, but you could list that condition there. Provide as much information as you can. It does ask you for a provider's information, but if you don't have a provider at the time, then you can indicate as such. It's definitely a possible situation. Jackson asked a question about whether type 1 diabetes falls under medically frail. There are a good number of items in our medically frail list. Generally speaking, it would be type 1 with complications, like really well managed type 1 without any complications probably doesn't fall under that. That's my understanding, though I would really defer to our clinicians about that. Kale asked, will these be physical letters and email? As a general practice, we'll mail things out to folks, but if you've also opted for electronic communication preferences like email or text, the department will get in touch with you those ways also. But we will please ask you to keep an eye on your mail because that's kind of the main way that we send things out to folks. Seeing if there's any other. Jeff asked about the website. I think I'll paste that into the chat here in a minute, get you the full link there, Jeff. And then I think that is, sorry, there's a lot of questions, there are a lot of comments here. So that's about as far as I was caught up right now, Tilia. So I'll turn it over to you and then we can bounce back and forth.
Sounds good. Yeah, I don't have much else to say, but I just wanted to quickly show our website because this is going to be the most up-to-date source for anything that might change for work requirements or just making sure you have the most current resources. So, like Drew said, we can paste the link in the chat, but just some general overview of work requirements, a lot of what we discussed today. If you're navigating this page, you can click over on this sections. To jump to the next part. We have an overview video of general work requirements. You can learn about exemptions, hardships, qualifying activities like working, attending school. And then this gives a lot more detail on those months you have to meet work requirements. So if you're still a little confused about that, this is a good resource to learn what month you actually have to show you met work requirements in order to meet those requirements. And some contact information, how you can submit all of that. This is a good page if you are looking for resources on how to volunteer in the community. This is a quick link to iServe, which we mentioned lots of times. And then the Nebraska Department of Labor has job seeking assistance. Some more resources like an FAQ. And this is quick on how to meet work requirements. So overall, just a good one-stop shop. If you want to learn more about work requirements, please visit that webpage. And there's a button at the top that you can subscribe, put your email in, and it will let you know if any updates have been made to the page. So that's the end of my spiel, and I'll let us get to some more questions.
Drew, did you have any questions in the chat that you would like to, if maybe there's some recurring themes that you'd like to share with everyone who maybe isn't going through the chat?
Yeah, I think we've been largely keeping up with what's been in the chat since we started. Yeah, a lot of the kind of the common themes that just to kind of recap, nothing maybe too much new since the last time I hopped on the microphone here. Stephanie actually asked a great question about how far in advance do we send people notice about their renewals. So just to kind of generalize how we process renewals for Medicaid, our workers will start working on them 60 days, 2 months before your renewal is due. Like I said, the department's going to do their best to verify that you meet these requirements without contacting you. Really, a lot of folks, if we already know your current income, a lot of folks are going to be able to be qualified that way. Just as an example, if you already are on Medicaid and we have some of your claims history, medically frail cases are going to get processed automatically a lot of times too. But if we can't tell that on your own and we do need more information, we'll send out that form, give folks 30 days to respond. Um, as a matter of our like business process, we add 5 days to that to allow time for mail to travel all across the state because um, Nebraska is a big state, lots of folks spread out all over the place. So, but that's kind of good question, Stephanie, about kind of time frames there. I also responded to that in the chat also. Um, but yeah, general themes that kind of recurring questions. Yeah, we talked a lot about medically frail. Hopefully, folks learned a little bit about that. I think Celia, if we have like a contact information or a contact point we could put in the chat for folks to get in touch with us afterwards too, that'd be awesome. But talked a lot about medically frail, talked a lot about kind of the different exemptions, people's kind of situations. If you're a caregiver, for instance, yeah, I mean, lots of great questions. I did try to respond to most of them throughout here. But if folks have more questions, I see Celia said Celia with our inbox in there. Please reach out to us that way. We'd really like to hear from you. Um,
I
and then
see one
seeing
here that says that there's a parent and they have full-time students. Would the students need to meet those work requirements?
so a parent with full time, um, how what age are we talking about with full time students? Are these like
We'll,
middle
we'll go
school, high
both. So what
school?
if you have elementary students? Would they
Okay,
have to? Or high school? We'll go because I guess generally elementary school don't have jobs. So we'll go high
yeah,
school
right.
students
Sure,
under
sure.
minors. We'll go
Uh-huh.
minors.
Yeah, no, that's a good question. So, one of the exemptions, so if you're a parent and you have, this would only be a portion of high schoolers, right? But if you have any dependent in the household who is up to, not including, but up to age 14, that parent's exempt. But for parents who have older teenagers, if you will, um, your your kids being in school, that part would not qualify as an exemption. So the parent would still have to complete these activities or have another exemption, but there isn't an exemption specific to having like, 16, 17-year-old high schoolers
So the
in your
parent would
home.
need to meet the work requirements, but the
Yes.
student would not. If the student is 19 years old and in high school, would they need to meet the work requirements?
In that case, if they're 19,
Mhm.
they would because that at that point, if that individual is on Medicaid, but they don't have like disability or anything else like that, they that in that 19-year-old would also be in the expansion category. But that 19-year-old being in school would exempt them from the activities that, or sorry, I wouldn't exempt them. That would be the activity that would qualify them as they're being in school full time. But that activity would not apply to the parent. The parent would still have to complete that kind of independently of their child. Sorry,
Okay.
that was a bit of a circular explanation there. So hopefully,
No,
hopefully that
it
made
was
sense.
very nuanced, so we had to get through it. What happens if you can't work 80 hours a month? I have only had volunteer jobs that I can say that I can't make it because of disability.
hmm Well, in I'm going to go out slightly on a limb here and say that those volunteer jobs would count as community service or volunteering. So if you are completing those activities, you are at that working with that volunteer organization for 80 hours a month, that would count. I did hear as part of that question though that you might have some sort of underlying healthcare condition situation that might prevent you from working that full amount, even if it's just at a volunteer organization. And in that situation, you might qualify for an exemption just on the basis of being medically frail. So, um, everyone's case is a little bit different. I always pause to not speak too granularly just because everyone's situation is a little bit unique, of course. But um, those are
Right.
maybe
And for
kind of
any
two ways
specific
you can look at that.
questions or
Hmm.
specific situations, always reach out to the department. They can work through your situation with you. What if it's okay? I'm still confused about whether or not the state will accept non-traditional work, such as freelance or gig work, as work.
Yeah, and sorry, Caspian, I did see your question earlier in the chat, and there's just a lot to keep up with. So I meant to get to this one earlier. So, um, yeah, so being self-employed, if you will, or gig work, freelance work, those do all count. Um, so you would have to report your income, just like you would if you worked at a more, um, sorry for lack of a better word, maybe like a more traditional kind of work arrangement. We have gotten some other questions from folks about like if you are self-employed but you work at, starting up a business or something like that, you work at a loss for a period of time. As long as you're working those number of hours, that could still count as like your work hours under these requirements. So, um, yeah,
Okay, so
that is a good question though.
would you just do like a self-attestation then of how many hours you're working? Is that how
Yeah, we
that
we
works?
would
Okay.
we would contact you for information. It's like we don't have income information necessarily. We would reach out and you would tell us that, yeah, I do work 80 hours, but it's, maybe I worked at a loss this month or whatever the particulars of the situation for you might be. So
Okay. Another question. Would it be fair to say that if there is no renewal notification, then no need to be concerned?
that is kind of along the lines of what we've been telling folks. The department is really going to do our best to use information we already have to renew your case, including seeing if you meet these requirements for having an exemption. So if you don't get like the form that we looked at in the mail from us, um, we don't need that information from you. But I would say just one piece is that you should get a notification from us in the mail in that situation, and that would be that your coverage was renewed because we do have to notify you of any action on your case, even if it's a positive one, if you will. So,
Okay. We have just a few minutes left here, but do organizations need to have a release of information form signed by volunteers in order to verify the hours, or how would that work for volunteer hour verification?
I'm sorry, can you repeat that question? I was reading another one, and
Oh, sorry.
that I'm sorry.
No, you're fine. Do organizations need to have release of information forms signed by the volunteers then in order to verify hours, or how does the volunteer hours get verified?
Right now, we're accepting attestation from folks on their volunteer hours. That was one of the pieces on that form that we looked at. I didn't focus on that particular question at the time because we were trying to talk about medically frail at that point. But yeah, we do. So it's actually the on the first page of the form, and I could even screen share again quick just to we can look at it here. But this question here is did the individual volunteer in their community qualifying month? Yes or no? So how long? We want to know like what organization you worked with and whether um, you have a contact that we might be able to reach out to. But right now we're not needing like a release of information or anything that rises to quite that extent. So
Okay. And now we have a more technical question. I read through it and it said that current Medicaid members need to meet 1 month of work requirements in the eligibility period before your renewal. Is that the requirement? Is the requirement to meet only 1 month in that year of eligibility where it says must do 80 years in at least 1 month? Or is it every month must do 80 hours?
that is a really good question because I think we've um, folks have had slightly different understandings of it. So um, when DHHS is renewing someone's Medicaid coverage, um, kind of the bar to clear, if you will, is that the department only needs to verify 1 month um, since your last renewal. So it doesn't really matter which month that is. As long as you have at least 1 month where you've met these criteria, you basically you met work requirements for the entire period. So it doesn't matter which month as long as it's been since your last renewal. You know, we know that a lot of folks are probably meeting these requirements most months. So there's that too, but we're only really having to confirm 1 month. And it's whatever month that we can get the information that you share information with the department, basically. So
Okay. All right. Well, I know we have, if there's more questions, I'm so sorry that we didn't get to all of them. There was so many. I really hope that we got to all of the questions. If somebody has a burning question that we didn't get to, please put it in the chat now, and we can try and get that answered quick before we sign off. I just want to be very respectful of everybody's time.